Hello everybody, this is Black Coffee with Ice, and we got a special guest today. First healthcare professional ever on the show.
Yes.
Denise.
Hi.
We go way back, hey?
We do go way back.
Way back. Back when we were, young. Denise is a nurse, young nurse. You're 22, right?
22. Yep.
22. Wow, Taylor Swift birthday, and you're a nurse. Who would have thought?
I know. Not me.
No, that's crazy. So, yeah, just tell everyone a bit about what you do and who you are.
All right. Do you want me to start from, schooling?
Just from schooling, whatever you want to talk about.
I don't know.
Open-ended question. Open-ended conversation.
So, I work at Gimli Hospital. So, it's fairly, I'd say, acute there because it is a small-town hospital. So, there's really just one ward in our emergency room. So, I'm kind of mostly on the ward as an LPN, but it's busy.
Yeah.
It's very busy.
You're always working.
I'm full-time.
Oh,
so
yeah.
I'm there how many days a month? I have 8 days off a month.
Yeah, it's insane, people.
Yeah.
Like, for everybody listening, this kind of is a podcast for people who are thinking about going into nursing, or a lot of friends I have that are in nursing school, and just people that are just curious in general. And I'm just saying, it took so long for us to schedule this.
Yeah, I know.
Because she's just so busy. But I understand because, I don't know the actual grind of the job, but I know the studies, and that just seems like on a whole nother level. So
it's shitty.
Yeah.
It's shitty.
Yeah, so you just had 4 days off. Yeah, just explain to everybody what you told me.
Well, I normally have no more than 2 days off. But I traded with someone, so now I have my 4 days off and I work 11 days in a row, including a night.
Yeah, that's like
stuck
shift
in the middle.
work, right?
Yeah.
That's insane. So.
Yep.
Oh
So
my God.
Friday I'm gonna go in. I'll be there from 3:30 p.m. till about 8 a.m. Then I sleep and then I come back for 3.
That's insane. Yeah. Actually, what's the difference between like an LPN and RN? Just to clarify that with everybody.
Well, an RN is like a degree, so you have a university degree. An
Oh.
LPN is like a diploma, but there's no just pay.
Oh, okay. Same thing though.
Yeah, that's shitty, but you do the same thing. You get paid less, but.
Oh, okay. Just different title, different salary. So what type of nurse would you qualify under? Like what kind of specialty?
I don't know. We get all different kinds of patients. Like it's not. Like for like my practicum, like we did maternity and like pediatrics and surgery and medical, and we kind of are everything.
Because you're in Gimli and
because it's in Gimli and that's the only hospital, so we can get anything. We get a lot of stroke patients, a lot of cardiac, like it's just everything.
The leading cause of death for elderly people, Alzheimer's, heart disease, and
there's a lot of old people. Yeah. There's a lot of palliative patients that come to Gimli for their end-of-life care. So that's, I guess, kind of the shitty side of things. It's a lot of old people.
That would be tough, honestly.
Yeah.
The palliative care, that is something that you have to be built some type of way to do that.
So that's been, I think, more eye-opening for me because we did have a palliative rotation, but none of us really had palliative patients. So, yeah, my first death was, well, I guess it was on practicum, but my first death for one of my patients was in Gimli. So it's been a good experience because I have like a little bit of everything. So as a new grad, I think it's important.
Yeah, no, that would be something to consider too, because I just know like the more remote you go, the more responsibilities you're going to have in the hospital.
Exactly.
So. Also, why did you choose nursing over other healthcare modalities?
I don't even know. My mom's a nurse, and then her sisters are all in the healthcare profession. So I think it was kind of, I grew up just knowing that as a job. And I don't know. I don't even think I've ever thought of doing anything else.
Oh, that was just it from day one? Yeah.
Like, I don't even know what to say when people ask me that. I'm like, I don't know. There was no other option for me. So it was like, if that didn't work out, then I don't know what I would be doing.
I know, that's kind of like it's like, that's all I ever wanted to be was a doctor. And if I didn't have that, then, I don't know.
I know. I don't even know what to say when people ask me that. I'm just like, that's that was my only option.
So I guess I won't ask you what you would be if you weren't a nurse, because you don't know.
I don't know. I don't know what I would be. Yeah, I don't.
Yeah.
I don't know.
Something in the healthcare field, probably.
Probably.
Yeah.
I don't know. I don't know.
No, that's
I'm
all
just
good.
trying to think. I don't. Yeah, there's nothing else I really am interested
Like
in.
anything that like is like, you know, for example, for myself, it's like, I say, if I lived a different life, if I lived 2 different lives, one of them I would like to be like a finance kind of guy.
Yeah.
Another one I would like to work as a correctional officer in
That'd be
a
cool.
jail. Maybe, I don't know. Like just if you had to live another life or whatever, maybe.
I don't know. I'm not good at math. I'm not
Either am I.
a sciencey person. Like I don't know. Like I'm just kind of useless when it comes to anything else. So I don't know.
Well, maybe you just have the perfect job for you
I
then.
think I do, even though I hate it sometimes.
Yeah.
I couldn't do anything else.
That's just so many hours. I could see
Yeah.
why.
It's demanding. Like I think that's one thing that they don't show you on practicum and in school is how demanding it is. Like it's not a 9-to-5 job. You can't, if you're not done when your shift's over, then you're stuck there till you're done doing whatever charting, or if an emergency comes in, or mandating. That's another thing I think Gimli is bad for, is that you could be there all day and someone calls in sick and then no one comes in, then you're stuck there for another shift.
Fuck, damn. What do you do to like relieve stress in your situation? Like,
I try
enjoy
and go
time?
to the gym, but usually eat, go out to eat,
Yeah.
go
Me
out with
too.
my friends, come back here. But I don't know.
Yeah.
Or cry. So, you know, sometimes you just
mixing a good cry.
you just
once
need
in a while.
a good cry at work, or sometimes I leave work and then I think another hard thing is just not taking things home with you from work. That's one thing I struggle with. Like I will call back like that morning and
Just
say,
to
oh,
make
like
it-
how's my patient? Or like I think we're all out and Gimli bad for that. And I think it's just like a compassion thing, but
Yeah, I was actually gonna ask you. So I feel like, just relating to that, I feel like medicine in general is just like a balance between like the science and the art. You know, the science being the analytical, figuring out what's wrong with them, treating that patient, but then also the artistic side behind it, focusing on the patient and worried about patient-centered care, where you consider other social factors and different things that may influence the treatment that they need. Do you feel that nursing is a little bit more focused on the art, such as really understanding and empathizing with the patient?
I don't know. Like I think compared to like a doctor, yeah. But I think at the same time it's like a balance, and I think that's what I think I struggle with, and a lot of people I work with struggle with, is that like you obviously need to take care of them medically, and sometimes you're too focused on what's wrong with them like medically that you don't look at, oh, like maybe their spiritual health isn't there, their mental health isn't there. And I think that's something you will learn as like
Through
you work
practice.
more, because I know like I'm, as a new grad, I'm like, oh, like they have this and this, and like that, this is what I have to like look for and treat, and you don't really have a holistic approach to patient care. I don't know if that's what you're asking, but
No, it's fine. That's
I don't
good.
know. Like I think that we were taught that in school, is that you need to look at obviously all parts of
But it's
someone, but like at the same time, if they're super sick, like
you have to
you have to treat them medically, and then you can start focusing. But sometimes you just forget, and then sometimes you're also way too busy.
Yeah.
Like sometimes I don't sit down all day, and you don't pee, you don't eat, and like that makes it hard for you to care for someone else when you're not looking after yourself. That's another issue, I think.
Yeah, because when you do have time off finally, like I notice that even when I serve a lot in a row, and it's a lot of running around, but it's way less hours. So, you know, after I do that for a long time, I'm tired. I need to like relax. And so when you have all that work, the crash is going to be that much harder.
And you're just done, or you don't, like you come back and you just don't give like the best care you could, or you're just too focused on charting, or you're too focused on getting this done that you're not really giving the best care you could. When you're tired, it's hard to, like, if you don't care for yourself, you can't care for someone else. So
it's true.
Nurse burnout is real.
Oh yeah, definitely, especially with all those hours. Considering nurse burnout, are you feeling that burden from, remember like earlier in the year the Palliser government like took away the nursing jobs? Like, are you feeling that because he took away the jobs, there's like more responsibility for you guys? Yeah,
there definitely is. And I think just understaffed or heavier patients. Like, we, compared to a lot of the wards I've been on in school, this is definitely a heavier care ward, and you're more expected to do patient care, like AM care and like getting them ready for bed, and that's hard because you have a lot of other stuff to do, and it just has to be done. So you're just kind of, I don't know, trying to do 2 jobs at once, and that's what I've found super hard is there's not that many staff.
Yeah.
you don't have enough staff to do everything you're supposed to do. And like, I've had those shifts where I've been able to actually sit and chart and look through their charts and like actually like research like the patients or like even sit down and talk to them, but like we barely have time for that.
And see, look,
and it sucks.
So it's true, like just from the inside looking out, it's actually like cutting these jobs is decreasing the quality of care that you can give.
Completely.
For sure. Yeah,
completely. Because I feel like I'm just running all the time.
Yeah.
And I feel bad because I know a lot of like the people, they are lonely and they just want to sit and talk to you, or like,
yeah. And it's nice to talk to older people, because if you just take a second to think, like, man, they're so wise. They've been through so much. It doesn't matter. They've been through like a whole lifetime longer than we have.
If someone's not doing well and there's no one there, like, you want to sit with them and be with them, but you can. Like, it's hard to find that balance. And if you have time, there's something else you could be doing or helping someone else out, and
just endless.
It's awful.
Yeah, it's so weird. Like, healthcare is so weird because there's just, you know, it's this quote that I found when I was doing research a couple years ago. It's called, the more you know, the less you know. So the more we know about a specific disease or some type of pathway or some type of, pathology, the less we know about it. For example, it's like, oh, wait, what we thought we knew before is actually wrong.
Yeah.
And it's like, oh, man, that must be so tough.
Yeah, healthcare is a weird thing.
It's a weird thing.
So weird. And I don't know why I got into it some days. I'm like, oh, I hate my job. And like, I love it, but I hate it.
But what motivates you, though? Like, when you're having a shit day, you're like, fuck, well, like, is there some parts that are like, hey, this is...
Sometimes I just have a shitty day and I, like, contemplate quitting and, like... And then I think, like, just having something, like, good happen at work, or, like, having someone say, like, something nice about you at work, or... I don't know, like, there's those little moments where you're like, okay, like, this is why I'm doing what I'm doing. Like, that happens not often. but
enough to stop you from quitting.
Yeah, like, I think the good outweighs the bad. Like, I think there's a lot of bad, but you have that one good thing, and that outweighs everything shitty that's happened to you that one day. And, like, I love the people I work with, so that makes a huge difference. I think I got super lucky with the job I got. Everyone's so nice, and they're patient, and they're willing to teach you, and so that I don't hate going to work, but like, sometimes I feel like I hate going to work. But
I was gonna ask you, do you feel like it's similar to some other jobs where you're like, you know, anywhere you start, right? Any new job you start, you're kind of shitty at it for the first couple weeks or months or whatever, and then eventually you get good. Is it kind of the same thing, and you just kind of learn as you go?
Yeah, I feel like school just doesn't teach you anything. Like, I think that's one thing I've realized, that even like being on practicum, they kind of sugarcoat everything, and they don't really, like, before starting to work at Gimli, I never was given more than 3 patients on practicum. And then you get to Gimli and you can have up to 7.
Whoa.
So it's
more than
it's
double.
just like, it's not realistic with what you learn in school, and you're like, you always have someone there making decisions for you, or someone like to kind of walk right beside you, and then you get out. Like, I was with like a couple of nurses, I think, for the first 2 months, and then I was by myself, and then I'm like, fuck. Like, I am the grown up here, and like I have to like make my own decisions. And I think, like, obviously I still ask so many questions, and like I just if I'm unsure of something. But like I feel like my critical thinking has improved.
Oh yeah, because you have to be on the ball. Like you're in charge of 7 people
Yeah.
sometimes. Like that's a lot of
And like
people.
if someone's not doing well, like I'm like, okay, like don't freak out. Like
it's just you. Like everybody
I'm
else
like,
is
fuck,
busy.
What do I do? Like I think my critical thinking, decision making. That's another thing I think you don't get to do in school. You don't get to really make your own decisions. Little like tips and tricks that you learn along the way, and like I don't know. Like I just feel like from when I started there in June to now, like I've learned so much. Like I can't even like imagine like what I was like in June when I started. I'm like I was so dumb and like not dumb, but like I knew nothing.
Yeah, and now you can hold your own.
Yeah,
you're a nurse. You're a nurse. Though.
Some days I'm like,
that's
like,
crazy.
Yeah,
though.
I don't know. It's a lot of hands-on stuff. Like, and there's just some stuff I just don't think you'll ever really learn or get used to. Like it's just like a new day every day. That's kind of what it seems like. And I learn something new every day, which is awesome.
Yeah, that must keep it interesting though. Like do you read at all on your own? No. You just work and
sleep.
Yeah.
Eat and work.
And sleep.
And sleep more.
I also have some advice, but do you have any advice to other younger nurses or people going through the nursing system, like how to get in and such, or just any suggestions of like classes to take?
I think what I would say is become a healthcare aide first before you go into nursing. I think that's kind of where I went wrong. Like, I'm glad I love my job, but I think if I were to hate it, like, I don't know. Like, I think definitely somehow get into the healthcare field before you decide to do nursing, because you will go through school, you will go on your practicums, then you will start working, and you will realize how different it is and how shitty your job is sometimes. And, like, I think if I was in the healthcare profession before, I think would have opened my eyes a little bit. Like I still think I would have gone into nursing, but I think just to have that background is super beneficial. And then you're not kind of going in blind, because that's kind of how I was like. I'm like, I don't even know like what I'm getting myself into.
Yeah, you had no idea. Like you went to
clue.
You went to kind of a remote out of town hospital, and it's like so much more responsibility.
Yeah, and I've been thrown in the ER some days, and I'm like,
oh my goodness.
Like what am I doing with my life? Like it's just, and I think another thing is just you can't be comfortable like with anything. Like I don't know how to say it. Like everything's gonna be super uncomfortable at first, and like I don't know, like it's shitty, but you'll get used to it, and I don't know.
Yes, people survive.
Yeah.
What technology do you use the most? Just like the electric medical records, or?
We are paper charting, so.
Oh my god. So, do you like it better? Or?
I haven't done anything besides paper charting, like even in school.
Oh.
So that's kind of what I'm used to, and I'm a big like paper and pen person. Like I will write everything down.
That's way harder.
And I'm not good with computers, so I don't know. Like, we paper chart. We have like obviously like our like charts online, like our like health records and stuff. You can access if you have to, like for vaccines or whatever. And then other than that, like we don't have a Pyxis.
I don't even know what that is.
It's like most hospitals have it. It's like where your medications are, and you have to like sign in, put your fingerprint on it, and like that's how you pull all your medications. We have like it's an old-fashioned med cart.
Oh, really?
So I don't know. I'm like used to it obviously, but we had the Pyxis in school, so that's what we used. Other than that, that's pretty old school. They're kind of nice though, because it's not gonna give out on us, which is nice, but it's nothing too fancy there.
How did your first day of nursing go?
Like for my job?
Driving up to work, like how did you feel? Were you a little bit nervous?
I think I wanted to puke.
Yeah, I couldn't imagine.
I think I did puke maybe at one point that day, but felt like I was kind of walking in blind, but it was good. We have like a long-term care end in the hospital, so it's like for people who are waiting to like go to the care home. So I was put on that end, so it really wasn't that bad.
Oh, okay.
So
they eased you into it.
Yeah. I think it was okay. Like everyone was super nice there, so that made it easy, but I think I wanted to puke. But I think that's how I was, like, every, like, first day of like, a practicum or school. But I'm a very anxious person, and I like to do things perfectly, so... But no, it's been good. I don't love going to work, but I don't mind going to work now.
Overall.
Like, it's not awful. I'd rather not some days, but I'm there.
If it was less days, it'd be, like, the ideal
job. I think we're going to switch to 12s, so that will be nice.
Oh, like 12 hours?
12-hour shifts, yeah, because I'm 8s right now. So.
But 8s, but, like, more days?
Yeah, because in order to get full-time, you have to have 10 days in 2 weeks. Yeah, but it's good because then I don't, like, miss anything exciting because I'm always there and
all the drama.
Lots of experience and I always know what's going on. Yeah. But it's not bad. I don't know. It's a job. I think I would like to go back to school at some point. But
would you like to become a nurse practitioner?
That was always the plan, and now...
Or a PA maybe or something?
No, my issue is I like bedside nursing. And I know nurse practitioners don't really do that because it's not really...
It's pretty much like a GP.
Their job. Yeah, like it's not their job. Same with PAs.
What would you have to do then?
Well, I was looking at an operating room course.
Oh, our nurse?
Yeah, that's in Saskatchewan though, so that's a big move.
Oh.
I've only been in the OR like a few times. I feel like it would just be good to have.
Oh, yeah.
Anyways, as an option or like, I don't know. Yeah. Dialysis maybe, cancer care, I don't know.
I know a cancer care nurse. That's tough field. But I remember the doctor I shadowed, he was just like, Justin, you can make your life so easy if you're nice to the nurses. Like, he's like nice to the nurses, and I could totally see how some doctors are probably like just, you know.
I think all the doctors I work with are fairly nice. Like, but on my practicums, I don't know if it, like...
Just because you're a student?
Like, I don't know if that made a difference, but there was one who was very... like willing to sit down and explain stuff to you, but I don't know. I haven't had an awful experience with the doctor yet, but I still think I'm still getting comfortable talking to them, and like that's something you don't learn in school. They don't really let you talk to doctors, like, because they, I think, would rather just hear the concerns from like the nurse you're with. So I think that's another thing I'm still getting used to is talking to the doctors when I have a concern. I'm like, fuck, like I just have to think what I'm going to say in my head right before I say it. It's
and that's when you mess up.
And then I'm like, I just sounded so stupid trying to like explain why I'm concerned about this patient. And
that's like the interview. Like the interview, I was like preparing because like my girlfriend's dad's a doctor. So when I did questions with him, it was hard because he's just looking at me and I'm just like, he thinks I'm an idiot. And then when you do it the actual day, I wish I practiced more with him because when I do it the actual day, I'm like feeling all good. Get in the room, I'm like, oh, this is a doctor. Hi. like, oh, I sound like
that's good you practice though. That, I'm sure helped a little bit. Yeah. Healthcare is a lot of like you go in blind. That's what I've learned. Healthcare is a shitty thing, but it's so like rewarding at the same time.
Yeah. I know it's such a perfect job of like mixing, like I said, science and art, and just overall like education towards healing, and I don't know, it's just like the ultimate field.
It is, and it's I think glamorized a lot too.
Oh yeah,
like oh my god.
Yeah, we were just talking about this earlier, like just how I follow that one. I think his name's like the urban nurse or something. For people who don't know, he's just a normal guy, became a nurse, and he just like complains about it all the time of just how much work it actually is, and how people on Instagram will like take pictures with the stethoscope and like smile.
It's so glamorized, and like, that's what I've noticed. Like I follow a whole bunch of nursing accounts, and it's like these girls, like they have their hair done and their makeup done, and they have like a stethoscope around their neck at work. I'm like, I go to work, I look like I'm homeless. I look like I haven't slept in like a day, which I probably haven't, and it's just, and like. You can't wear your hair down. No. Because you will get body fluids in it. Like, it's not glamorous. I guess depending on, like, where you work. Obviously, in, like, a clinic setting, it's different. But where I work, you are doing everything. You bathe people, you clean up people, you take them to the washroom. Like, you do everything. And it's not glamorous. It's gross. It's really gross.
Yeah, I heard just down the grapevine about this one situation. Well, I don't know if it was a doctor or a nurse. It was some healthcare professional. They went to a psych patient's room, and the psych patient had like shit in his hand, like rubbed it in his mouth.
It happens.
Yeah.
It happens.
Imagine doing all that school and then just for that.
And then you're dealing with shit every day. Yeah. Some days I just don't know. I think a lot of people complain about it, but I think you aren't any better than a healthcare aide. And I think that's another thing. I think a lot of, especially people in school, that they think, oh, we don't have to clean up our patients because we're not a healthcare aide. And
but you do.
It's your job. Like, it's part of your patient care. So
Patient-centered care, yeah.
Like, it's so glamorized. And even in school, like, they don't really teach you how to clean up your patient, or like, we spent a very short amount of time. So obviously, like, when you get on the floor, you think, oh, I don't have to do that. Like, the healthcare aide will do it. That's not the case.
Yeah.
And I've learned if you are good to your healthcare aides, they are so good to you.
And that's kind of, I guess, like, doctor being nice to nurse. See, it's all about collaboration and like
teamwork and respectfulness, and
they want to change that instead of like the old paternalistic way where doctor would just make all the decision. Now it's just so everybody works together, and that's what I'm so excited for. That's how it should be. I don't know.
There's obviously doctors who just don't, like, they can make their own decisions, but they're humans too, though. Like, will listen to the nurses. Like, we have this one doctor who will not go into a patient's room without one of us there.
Yeah.
So see. He's like, one day, come with me. I'm like, this is not even my patient, but okay. So I think, I don't know. It's weird.
No, yeah, being a doctor is weird, man. That's just all that whole profession, but just like some people get into med school really young. No life experience, and then they just go in, and then
they have no skills. They have no communication skills. They have you need people skills no matter what you do in the healthcare profession. Like, if you can't talk to someone, you are better off, I don't know, doing something else. Like, and I think that's what I've noticed. I'm like looking at some people as they're working, and they're just not talking to their patient, or they're just awkward.
Yeah, because that improves...
Or just rude.
Yeah, and that improves the quality of care so much. Like, if you just sit down with, some lonely older person that has no family, just for like 10 minutes, just to have a conversation, that will go so far with them. And
if you can't do that, then you should not be in the healthcare profession. And I've seen that. I know some girls I've gone to school with where I'm just... like, why are you becoming a nurse? Like, they're very smart, but not, like, they're book smart, and that's about all. And I hope they're doing better now that they're out of school, and I hope they've gained some skills, but, it's stressful.
That's what my dentist was telling me. He's like, there's people I went to school with that I would never let them near my mouth at all.
Oh, God, no.
And it's just like, no matter how hard it is to get into specific faculties, there's always going to be like a few bad apples that slip through the cracks.
Because they're smart and they have good grades. And, like, I mean, you need to be somewhat smart to be a nurse, to be a doctor. Like, you have to have, like...
some type of knowledge.
Like, you wouldn't pass school if you didn't. But at the same time, you have to... have that compassion and understanding, and you have to know when to draw that line between, like, you can't, like, how compassionate can you be with your patient, and then when it gets to be too much and, like, you're not doing, like, patient care well, and, like, I know that's one thing I struggle with. I'm just like, I just want to sit with everyone and talk with them, and, like, that's not realistic.
Yeah, if there was enough nurses, a lot more nurses, but
and, like, and then you have to draw the line to where, like, you're not going to take that home with you. Like, you can't be hard on yourself, or I don't know. It's so weird.
It's so weird. Like, you're so young.
It's so emotional, and I'm like, I don't even know what I'm doing with my life, and I'm trying to help other people. Like, I can't give any advice because I just don't know.
Yeah, it's weird, man. Like, I just remember we were just in grade 12, boom, graduated, and then you're just off to Brandon. Yeah. Becoming a nurse. And then
it's a wild ride, and I don't know. It's crazy. It happened super fast. Like, I graduated, when I was 21. I'm like, I am only 21.
Yeah.
Like, what am I doing? And I think it did help that I moved away when I was 18.
Oh, because then you got to have some fun least.
And then I was like, okay, like, I'm okay with not moving back home. Because there weren't really any jobs here I wanted. So I guess that was the good side of things, that I was comfortable enough being on my own to where I could have a decent job out of town. But Gimli's shitty.
Yeah.
Gimli's really shitty. I don't spend any days off there, but I don't know.
Maybe in the summer.
It's a good job, and that's what I just tell myself, because I know, like, one of my friends got a job there too, and she's in Selkirk now, and we're just talking. We're like, I doubt anyone else in our class has a job this good.
Oh, yeah.
So I just, like, I try and be thankful as much as I don't like it sometimes. I know a lot of the girls got long-term care jobs, which is not the greatest as a new grad. Like, it's not, I don't think where a lot of people want it to be is in a care home, but so
that's where majority of people are going.
Yeah, like, I think that's really all that was out in Brandon when we all graduated. So
I guess because the increasing aging population too.
Like, a lot of care home jobs, like, especially as an LPN, there's a lot of care home jobs. So, and that's, like, I was like, I am not working in a care home. I did not go to school for 2 years just to, like, lose all my skills in a care home. So I'm very grateful, because I have had a lot of training through Gimli, and, like, it's good experience. So I just keep telling myself that as much as I hate my job sometimes.
It's making you better.
Yeah, it is. It is making me better, but God.
So you're back to work tomorrow, hey?
Friday.
Oh, Friday. Oh, yeah. You
Friday
have some plans
evening.
tomorrow, though.
Yeah.
That's good, though.
I think I'm going to go buy some plants.
Oh, nice.
Put in my apartment, because it's kind of...
Yeah, do you have an apartment in Gimli?
Yeah.
And do you also, like, go from there to home?
Yeah, so I come here on my days off and stay with my parents, but it's just shitty up there. I wish I didn't have to live up there, and I was thinking maybe if we do go to 12s, I could, like, handle driving in.
Yeah. Do they have a gym there?
They do, and it's super tiny, and it's, like, hard because there's not much, so I, like, try and go at really, like, weird times when there's no one there. Like, when I work in evening, I will get up at 6 just to be in the gym by 7 just because it's empty. And then that just ruins the rest of my day, because I go right back to sleep because I only got 4 or 5 hours of sleep. Or, like, at the end of the day, I'm, like, right after I'm done work, it's so busy. So you can't really do anything. Like, there's no equipment there. So I will go home, and I just will not go back. So that's the shitty thing. I'd love to be, I think, in the city. I think it would be better for me, but
yeah, it's harder to get a good job.
Yeah.
Damn.
I know.
Trade-offs.
I know.
But at least you get experience out there for a couple years even, and then move back. Or go to Saskatchewan. Who knows?
I don't know. We'll see. I don't want to leave the hospital, but I'd love to leave the town. Yeah. It's lonely.
It is lonely.
It's so lonely. And the winter has been tough. I have not spent a single day off there by myself.
Really?
No, I'm always here. Always on my days off.
I guess it's like a 45-minute drive.
Yeah, it's not awful, but it's shitty in the winter. Like, I don't want to spend, I don't think, another winter out there.
Yeah.
So maybe I'll move. I don't know. It's shitty.
It's not that bad.
It's just I don't want to move. I move so much. So it's trade-offs, that's for sure. But
you're just thinking of work on Friday.
Yeah.
You're just like, fuck.
I know. It's going to be tough. I don't think these 4 days off are worth it.
Yeah,
So I've done nothing. All I've done Monday, I slept all day. Literally all day. I did not leave the couch. Yesterday, I woke up, drove my friend to the airport, and I went back to bed at 11 a.m. I went back to bed.
God.
Today I slept till like 1.
Well, at least you're getting those hours in. Nice and rested. I know I waste my, like, when I have days to do nothing, I just fucking sleep.
Like, you literally do nothing. I know.
I just love to do nothing.
I hate doing that, but
it's beneficial.
Yeah, it's so nice. But I think next week will be tough.
Yeah. 11 days in a row.
It's going to be awful.
Yeah, 11 days in a row. Well, Good luck with that.
Thanks. I'm gonna need it.
Okay. Any last words to any aspiring nurses out there?
Don't do it. Just kidding. Do it, but you're gonna cry and you're gonna really hate your life. But
it's worth it.
It will be worth it eventually. I hope I get to that point where I'm like, okay, this is worth it, because it doesn't feel like it right now, but.
So yeah, these are your words of motivation. At least she's being honest.
Yeah,
so that's good.
Yeah.
All right.
Okay.
Okay. Have a good one. Okay. Bye.